Well, good morning. My name is Janice Baker. I am here for our Facebook Live this morning from 9 to 9:30 Pacific, as well as 12 to 12:30 Eastern Time. It's really an honor to be invited, and I'm so glad to be here with you today. So thank you for everyone who joined. So I am a registered dietitian nutritionist in San Diego. I'm also a certified diabetes care and education specialist, certified nutrition support clinician, and board certified in advanced diabetes management. I've been in practice since 1983, first about 12 years working in acute care, med surge, critical care, cardiac rehab, pulmonary rehab, and diabetes management. And then in 1994, I went to outpatient as well as doing many classes. I've been with the same medical group, Arch Health Medical Practice here in San Diego, Arch Health Medical Group, and I've been there since 94. Also working in home health, also working in the eating disorder field, and many other areas. So during the almost 40 years of practice, I've certainly had amazing opportunities and have learned a lot. And just speaking of learning, that is what I continue to do. There's never an end to reading, to continuing education. I think it's a very, very big part of my practice. So I'd like to find out if it's possible where everyone is from. If you are able to type that in. I'm not sure if you're able to do that, but I'd love to hear about you as well and whatever your questions may be. I want to make sure also that we are going to be able to contact each other after this video. My contact information is for Facebook, it's Baker Nutrition, and my other social media account that I'm most active on is Twitter at Janice Baker RD. So either one of those is perfectly fine, but really happy to hear about you and any questions you have about my career, especially those dietitians sort of newer to the field. You know, I'm really, really happy to be a resource and pay it forward. So in terms of my background, I got my education at Cal Poly, San Luis Obispo, and graduated in 1981, did my post-graduate internship at Good Samaritan Hospital in Cincinnati. I grew up in Los Angeles, so that was a big change for me, but it was a great, amazing experience that I definitely am so glad I got the chance to have some time in the Midwest where I've never lived before, experience the weather, and the culture was also an amazing part of my education. Came back and got my first job here in San Diego and have been here ever since. But in the meantime, along with the experiences I mentioned, my background, I also got the chance to work in Sweden for a few weeks, for about 3 weeks, about 15 years ago, at a very large eating disorder treatment clinic in Stockholm. That was just an incredible experience to work in a different country, to experience the healthcare system in a different country, and especially a rather unique approach to eating disorder treatment at the Karolinska Institute in Stockholm. And since then, along with other parts of my practice, I have been involved in working with eating disorders and eating disorder clinics, which has also been a very much an increased part of my practice, alongside with diabetes and other medical nutrition therapy practice. And really, that part of my education has actually enhanced my knowledge of other medical nutrition issues and disease states, because there's oftentimes a very unrecognized overlap between eating disorders, disordered eating, and how it affects other medical issues, and how much it's unrecognized in primary care. So another part of my responsibility is weaving that into diabetes care, oncology care, geriatric care, making sure people are also screened for disordered eating issues in all kinds of ways, because of so many decades of people struggling with cultural implications on weight, body size, restrictive eating. And needless to say, since the beginning of my practice, when we had no internet or social media to speak of, that has exploded in creating so much more fear, stress, and anxiety around eating that permeates every part of my practice. So I can honestly say that today, in this area of my practice, it is almost in many ways more exhausting and more overwhelming for me as a practitioner to help dismantle a lot of misinformation, help people to find joy as well as health goals in the way they nourish their bodies, and taking into account many other ways to support their health goals that don't involve food. We have to pay attention to that for quality of life. So that's why in my diabetes work and my medical nutrition therapy practice, what I'm doing now more than ever is, of course, now is mostly telehealth. All of my classes that I teach, which used to be all live and in person, are now online. And my medical nutrition therapy appointments have now all been transferred to telehealth, which has actually been working out brilliantly. And I'm actually more busy than I ever have been. But being able to adapt and adjust in a short amount of time, because we didn't have much of a choice, has been very challenging. But at the same time, it has opened up another wonderful way for us to communicate with our patients and keep our patients safe and comfortable. And while it's not perfect, it's helped actually overcome a lot of obstacles to medical nutrition therapy for many patients of mine, because many live in places that are 1 to 2 hours away from me. San Diego has got traffic issues just like Los Angeles has, and access can be tough. So it does actually enhance how many patients I see. And of course, my classes that I could maybe fit 15 or 20 people into my online classes, which you can find on our hospital website, www.palomarhealth.org/classes. They are all free. Anyone can join. you can, we can fit. I have 75 people coming to my diabetes and nutrition class this coming Tuesday night at 6 p.m. Pacific time. And anyone from anywhere can join my free online classes. So the classes I teach include no-nonsense nutrition, diabetes and nutrition, caring for your kidneys, loving your liver, eating for a healthy heart. And I've introduced a new class on nutrition and COVID-19. That class has been very popular because of people surviving and recuperating and recovering from the coronavirus is presenting a whole lot of new issues. And part of that is the long-term complications we're hearing about COVID being possibly a risk factor for the development of new onset diabetes, coagulation problems, fatigue, malnutrition, sarcopenia, shortness of breath, mental health issues for sure. So my class on nutrition and COVID has actually been hugely successful. I'm very excited about that, and I also hope to be involved in helping to establish, with other colleagues, as has been done at other institutions, a COVID rehabilitation program. Because we're going to see, in my opinion, that that's also going to be needed for several reasons, as I've mentioned. So with that, I'm never bored, and just some things that I just always like to demonstrate that I use for my online teaching and on my classes. I've gotten away from PowerPoints. I use lots of props like my liver, my demonstration of strength training, hand grip strength, as well as devices that I actually wear as much as I can, like my Freestyle Libre. I don't have diabetes, but I get a chance to get samples from my reps to demonstrate online the benefits of the newer technologies. And being that I started working with diabetes before we even had any blood sugar meters, I remember that very well. It's so great to have these new devices to help people manage their blood sugars and be more intuitive with how they take care of themselves. Because honestly, the guidelines out there for diabetes management are just guidelines. Everyone with diabetes, as we know, is unique and individual. I get to also communicate with companies that make wonderful technologies. This is one I'm going to be talking about in my class. This is a new device that keeps your insulin pens, the insulin inside of them, nice and cool with this non-battery operated device that just replaces the pen cap and keeps the insulin cool in extreme temperatures so that we can make sure the insulin stays safe and effective. And honestly, also working with newer medications in the diabetes management world. When I just got started in the early 80s, we had one pill and a few kinds of insulins that, didn't really work. I still have a great passion for what I do after all these years, and still, start my day out every day, really being honored at the opportunity to do what I do. At the same time, that opportunity comes with responsibilities, so I can't say enough how important it is for us as dietitians to keep educating ourselves, listening to our colleagues, attending conferences, even if they're online, reading recommended books. One of my latest books that I am learning a lot from, this is called The Body Keeps the Score, The Brain, Mind, and Body in the Healing of Trauma. Amazing book. I can read a few pages and then I really have to think about it. This is recommended by psychologists and therapist friends of mine, which is shed a whole new light on what my patients come to me with when they're struggling with food, with weight issues, with eating issues, the trauma response that they have had over a lifetime. And I value my memberships in my professional organizations. I feel, honestly, they're great investments. I'm a member of Aspen. That's one of my favorites. And, really read cover to cover all of my journals. In fact, the latest journal article I'm just got started on is Assessing Malnutrition and Systemic Sclerosis with Global Leadership Initiative on Malnutrition and European Society of Clinical Nutrition and Metabolism Criteria. So yes, these take some focus to get through. However, these journals that I really value on the cutting edge, the diabetes practice group for through Academy of Nutrition Dietetics, really value my reading, my memberships, my collaboration, to make sure that I'm keeping an open mind and continuing to learn, because I can really tell my patients value that I am reading the things that they may not have access to help them unravel a lot of confusion. So with that, I would really love to hear about if there are any questions at all. I am looking for the questions here, but if I can't quite get to them, I will be really happy to answer them later. I'm not sure if I see the questions right now, because I'm one of those where technology is still a challenge for me. I'm still getting used to a lot of things. However, I want to make sure that, if you do have questions, I am really more than happy to hear from you through our Facebook group, through my Facebook page, Janice Baker, RD, at Twitter, or Baker Nutrition is my Facebook page as well. Really, really happy to talk about, whatever you have interest in. In terms of getting through my professional life, if you're in different stages of your professional life, I really do want to make sure that you realize it's not smooth sailing. I've also personally married my husband, who I met at college. He's an architect. He's working right down the hall. We have 3 children, and they're not children, they're young adults. They're all themselves have been through college. My 2 sons are engineers. One's a software simulation designer up in the San Francisco Bay Area. My other son is a mechanical engineer. Very proud of them. They both have their master's degree. My daughter, is 25. She's the youngest. She has her degree in kinesiology, but she's in Maui working as a veterinary technician and doing her postgraduate studies in veterinary medicine in Maui, who we finally plan to visit next month. Raising 3 children while working absolutely was interesting, and absolutely had a big impact on my career, because I could not work full-time with 3 children under the age of 5. And times were tough, and we went through recessions, and our house burnt down to the ground 13 years ago during the San Diego wildfires. So we have been through a lot, and we've struggled through. We've been fortunately very, very blessed by being able to recover by a lot of those hits. But the fact is that, during the course of your career, you do the best you can to be resilient, but there's going to be a lot of challenges. Needless to say, not just personally, but professionally too. Changes in people who work with, changes in people who make decisions, changes in insurance, changes in, what physicians are on board with referring to nutrition services as well. There's definitely quite a bit of factors that you have no control over. So at the end of the day, that's something that you need to put aside and make time for self-care as well as outside interests. One of mine is rescuing animals, and my 3 rescue tortoises. I'm now involved in tortoise rescue cats, rescue birds, and those certainly absolutely make a very big difference in how I, can divert my attention and take better care of myself. I'm sorry. Okay, I do finally see the questions. I see it. Okay. Okay, you're Minnesota, Dallas. Wonderful. Hello there. I'm from Chicago. And my oldest son, went to school at Illinois Institute of Technology in Chicago. I visited many times. And what will your advice be during the pandemic? During the pandemic, well, of course, I'm pushing the vaccines. Definitely pushing the vaccines. We're doing pretty well here. But post-COVID, really, it's monitoring recovery signs and symptoms, nutritional rehabilitation, and adequate nutrition, and making nutrition support easy for patients as well. Yes, I love Aspen. How do you feel about people without diabetes, but maybe who follow a keto, a carnivore diet, who use CGMs? I really do not see people really being able to sustain too well using keto or carnivore diet, using CGMs. Listen, if they have the cash and they can buy it and they have access to it, that's really interesting. Honestly, if you can buy a glucose meter anywhere over the counter, they're very inexpensive. But I'm kind of wondering what the bigger picture is. What's the purpose? What's the intention of using a CGM while following a very restrictive diet? Now, on the other hand, in my work with very critically ill patients who have anorexia nervosa, I was very fortunate to visit the Acute Center for Eating Disorders in Denver and meet Dr. Philip Mailer, who is a huge, I'm just in awe of him as the medical director, and I've read his book and looking forward to his 4th edition. Yes, patients who are in a very restrictive, starved state, they can have devastating effects from hypoglycemia because of starvation and anorexia. But on the other hand, I don't know how useful really in the long term the use of CGMs are for people who are on keto or carnivore. It's sort of entertaining maybe, but how useful and what the long-term necessity is, I don't know. What I wish, though, for is my patients with diabetes to have much better access to these great ways to monitor their blood sugar without being a pincushion, without punching their fingers several times a day. I'm just wishing for quality of life for patients. So, okay, so how do you think the perception of dietitians have changed in the past 40 years? That is a great question, because actually, having graduated from Cal Poly San Luis Obispo, we had to do a senior project, and I still have my hard copy, and it's on file at their library. So my project in 1981, when I graduated 4 years ago, was the role of the dietitian on the healthcare team. And I actually had to do with this all hard copy. There was no computers then. Mail out surveys to probably about 50 or so physician offices, collect the data, all hard copy, mail back surveys on how they perceive dietitians and the healthcare team. And that was 1981. So I feel like the perception has definitely improved. However, there's a lot of room for improvement. I think we have a lot more physician champions now as doctors, like one of my favorites, Dr. Paul Wischmeyer, who really promotes dietitians in critical care. I read every paper he writes. He's out of Duke. And he has done so much to promote the role of dietitians in nutrition support, critical care, enhanced recovery after surgery, post-critical care nutrition rehabilitation. He's a huge champion. I work with several endocrinologists who refer to me here in the San Diego area, and it's gotten so much better, but it's still, we need to still keep coming on with this and make inroads into this, and using our voices, using our spine, which sometimes we're a little shy about. I certainly was for a long time. But I think we just cannot stop making the point that we have the background, we have the degrees, and that is why the reading and keeping abreast on the currents in the literature, why I read all the endocrinology journals I can to keep up with the newer therapies and ask questions of the physicians I work with and give them some ideas and feedback. It really does make quite a difference when we come to them and ask them their opinion. What do you think of changing to this therapy because of these reasons I see? And really understanding the risk benefits of therapies and obstacles. I have a lot of patients coming to me with also tube feeding issues, because I do work in home health, oncology issues. I'm making some inroads into our oncologists who I've worked with for many years, who have been referring to me quite a bit, but I'm trying to get the message refer earlier, because when they refer to me, sometimes it's after so much weight has been lost. So yes, assertiveness is very important. Are you in any DPGs for the Academy? Yes, I'm in several DPGs, several. So I'm in the oncology DPG, the renal DPG, the diabetes DPG, the weight management DPG. I love the DPGs because, again, I love learning from the experts. And because I'm in primary care, I have to really sometimes ask questions of my colleagues to make sure I'm on the same page. So I'm in several DPGs, and honestly, I think that is just a brilliant way to get access to wonderful resources that my colleagues are so generous about sharing, and I can't say enough how important those DPGs are. So yes, I've been a 38 plus year member of the Academy. I feel like it's been a great value, absolutely. So any other questions we have for today? I want to say that again, I besides the DPGs, besides I really support Aspen quite a bit. Actually, of all the conferences that I've been really happy to attend and really excited to attend, has been the Aspen conferences. Unfortunately, this year's was canceled. I was all ready to go. I have learned so much from that. I've taken the CNSC exam several times, every 5 years to keep that up. That's a hard exam, but to me, it's worth its weight in gold, because all of the information that you use in studying for the CNSC and that you learn from the nutrition and clinical practice journals really translate very well to many cases in outpatient care, in the eating disorder care, in the patients who I work with pre and post-op bariatric surgery, because I do work with 2 bariatric surgeons and assess and follow those patients after. And many of my patients with diabetes have also coexisting malnutrition, renal disease, cardiovascular disease, heart failure, sarcopenia, fall risk. And so again, doing nutrition-focused physical exams, even when I can do things over the phone to help them show me about how their hand grip strength is, or body mass, or other descriptive physical symptoms, is actually quite important. I assess, I help, I watch them swallow, I ask about dental status. I talk a lot about the dental issues too, because that's a very big obstacle to nutrition issues. So it's really from head to toe, and needless to say, a very big part of my practice in everything is asking them about the relationship with food, their years of on and off dieting, and what kind of food and nutrition trauma or adversities they've been through. And it's amazing to hear even my older patients who've been through World War II or other traumatic events that they had nothing to do with has affected how they view food and eating. So, also reading, as I mentioned, trauma informed literature, hearing about historical ways food restrictions, food availability has impacted people's attitudes and ability to nourish themselves properly. Learning history about this, such as what I love to, often refer to is the Minnesota starvation study, which teaches us so much. The Ansel Keys study, how people responded to food insecurity, as well as food deprivation, as well as forced, restriction, and how that happened. So, again, learning history is also a very important part of our job, and that is why there's just so many dynamics to what we do, so many facets to nutrition support that is more than just the macros and the other aspects of food and nutrition that sometimes people just assume we hand out meal plans and tell people to count carbohydrates. As I mentioned with my patients with diabetes, that they love this fun fact, there's as many as 42 different impact factors on blood glucose levels. They often think, oh, it's just the carbs, it's just the bread. But when I talk about the impact of activity, of sleep, of dental care, of stress, of medications, of aging, of beta cells, of how your liver and your kidneys work to impact blood sugar and how your body handles medicine, it actually helps people relax a little bit and really understand from a wider angle lens how, it's not just the food they have to be anxious about, but how to actually communicate with their physician and their other healthcare providers better. Because when they can go into their healthcare provider, their physician visit, with more education, they can ask questions and they can sometimes challenge some assumptions that are already there. Their blood sugar may not be high because of the carbs. It may be because they had a tooth infection or urinary tract infection, or they were on prednisone for their asthma, and they forgot to tell their doctor that because it was from another office, and the medical records are not, communicating together. So it is really important to help also, besides the nutrition part, help coach our patients in communication with their other healthcare providers. And they actually have sent me some nice letters, some really nice notes about how much that has helped too. So I want to kind of also say, there's actually more to the story than many things we were trained for. Our college education was definitely great, and I still refer to a lot of things I learned in college. I had some phenomenal professors that I remember well. However, we need to keep building on that one way or another, absolutely. Okay, so yes, I am a very, very big fan. Also, I want to say, Built Up by Dietitians is sent a question. I'm a very, very big fan of Build Up Dietitians. One thing, again, it's hard because we're up against so much. And as I explained to my patients, marketing does not equal science, and we know about the labels that people are faced with every day. But I'm just such a fanatic about science, and that's why I so appreciate my 3 children have all benefited from that in their careers. Again, 2 engineers and one who's in kinesiology and veterinary medicine. They still come to me with some great questions about science, and I share with them. My 2 engineer sons are very into what they do, and engineering is a science. And as I tell them, I don't think there's alternative engineering. I don't think there's alternative engineering, and they fully agree with that. So I share with them really gladly the technology and the updates that are out there. But as engineers, not knowing nutrition science too well, they ask me questions, but they share with me what they've heard on their social media, in their Instagram accounts. My 30-year-old engineer son has introduced me to Clubhouse. His girlfriend is a PhD computer science major at Stanford. And she asked me about Clubhouse and their nutrition information there. And I sort of took a look on that. And I'm like, oh, this Clubhouse, this is a new thing I have to learn about. And so they're teaching me about Clubhouse. I'm not too sure about it yet because what I saw didn't impress me so much. But I have stuff to learn, definitely. But it's really great to have full-grown adult kids who are also very steeped in science to talk with and share things about technology and science. And now that my daughter is in the veterinary world, she's telling me about alternative veterinary medicine that she's faced with, diets for different animals. And she did work on a dairy farm, a goat dairy farm, for a year in Maui. And I learned about goat nutrition and having reptiles, tortoises as pets. I'm learning from a phenomenal, brilliant reptilian veterinarian about the GI tract and nutrition support of tortoises. They even get tube feedings, if you can believe that. That's another FaceTime Live. But I want to let you know how much, again, I think we're over. I appreciate everything everyone does, that you showed up today, and have a wonderful rest of your weekend. Take care.